Features of the congenital syphilis. Syphilis. To begin with, we ask some questions as usual. So first question will be the mucocutaneous findings in terms of the early features. And the next question we want to ask is the mucocutaneous findings in case of the late features. So these are the questions. We'll be answering these questions and we'll be discussing more in detail about this topic. To begin with, we look at the early feature. So here under early feature, we look at the birth weight. So the birth weight is nothing but there is a low birth weight, that is LBW. And what is the weight? It is less than 2500 gram. Next, what we look at is the mucocutaneous. So mucocutaneous, the early features, it includes the presence of, so let's just write it down, early. So under early, we have the findings such as the snuffles. There is snuffles. There is the MP rash. MP rash stands for the maculopapular rash. And after this, we also have the pustules. Next, also the mucus patches. Then there is the condyloma lata. Condyloma lata. Then the vesiculobulous lesions. There is also presence of the ruggeds, then a desquamation, and also the alopecia. So such things are present in case of early. Then we move on to the late features of the mucocutaneous. So what are the late features? So under late features, it includes the ruggeds. Then there is also the gammata. There is also presence of the palatal perforation. So there is the palatal perforation. Then we look at the dental. So when we look at dental, there is only the late perforation. So what happens in the late perforation? There is the mulberry nodules. The mulberry nodules. And there is also something known as the Hutchinson triad. The Hutchinson triad. And this Hutchinson triad, it is a characteristic of the congenital syphilis. It is a characteristic of the congenital syphilis. So here the components, it includes the Hutchinson's teeth. Then it also includes the IK, that is the interstitial keratitis. And thirdly, there is a sensory neural deafness. So these are the characteristics of the dental findings in the late features. Then when we move on to the laryngeal. So what are the laryngeal findings in case of the early? So in terms of early, it is nothing but the hoarse cry. Hoarse cry. Then we move on to the ocular. So what are the ocular findings in terms of early? So in terms of early, the ocular findings, it includes the chorioretinitis. Next, there is also the uveitis and the glaucoma. Next, what we see is we look at the late ocular features. So here it includes the interstitial keratitis, and it also includes the uveitis as well as the glaucoma. Then we look at the gastrointestinal. So in terms of the gastrointestinal features of syphilis, this includes the presence of hepatomegaly. splenomegaly, hepatosplenomegaly, and also includes the pancreatitis and the enteritis. So all these features are included in the gastrointestinal. After this, we also look at the renal. So what does this renal include? So under renal, we are looking at the early features. So under early, it includes there is the nephritis, there is edema, as well as the ascites. So all these features are present. Next, we look at the lymphatics. So how are the lymphatics? So under this, there is the lymphadenopathy in case of the early. Next, we look at the hematological. Under hematological, the early features, it includes the thrombocytopenia. Next, it also includes the anemia, as well as the DIC, which stands for the disseminated intravascular coagulation. Now we look at the CNS. Under CNS, we look at early. So under early, there is the aseptic meningitis. Next comes the chronic meningovascular syphilis. Next, there is also the cranial nerve palsies. And lastly, there can also be the hydrocephalus. Now we'll be moving to the late features of the syphilis. So in terms of the late features, this includes the mental delay, and there is the eighth nerve deafness. The eighth nerve deafness. There are convulsion disorders. There is paresis, as well as there is the tabes dorsalis. Next, we are looking at the skeletal. So under skeletal, we look at early. So under skeletal early, this includes the periostitis. Next, we also have the osteochondritis. So the osteochondritis causing the pseudo-paralysis. As well as there is the osteitis. Then we just saw the early. Now we'll be moving on to the late. So what does this late include? So late, it includes features of the skeletal. It includes the periostitis. There is periostitis, and this causes the frontal and the parietal bossing. So it causes the frontal and the parietal bossing. Then we also have the sabri tibia. There is a scapula. Next, there is thickening of the medial part of clavicle. Thickening of the medial part. The medial part of the clavicle. Then we also have a short maxilla. We have a short maxilla. and a protuberant mandible. The protuberant mandible. Next, there is a saddle nose, then the Clutton's joint. So this was about the syphilis. Now we'll be looking at answering our questions. So as you remember, the first question was we asked the early findings in terms of the mucocutaneous findings. So in terms of early findings, it includes the snuffles. Then there is also the maculopapular rash. There is presence of the pustules. There is the mucus patches. There is the condyloma lata. Then comes the vesicobullous lesions, the ragates, desquamation, as well as the alopecia. Now we'll be looking at some late findings, the late mucocutaneous findings of the syphilis. So in terms of late, this includes the ragates, then the gammata, next the palatal perforation. Now to check if we understood, we are going to ask some bonus questions which can be answered in the comments. So to recollect, we are going to ask the dental findings. Comment on the firstly the dental findings in case of the syphilis. So here that is very prominent. There's a Hutchinson triad as well. So you need to explain everything. And the second question will be, what are the hematological findings? The hematological findings in case of the syphilis.